you very much.
Let me see. Our distinguished guests, Chairman of Board. First, let me apologize for the Honorable Minister for not being here. After arriving from the World Health Assembly, there are a series of meetings to try to find out what to do as a country, and then we put many things in place. There was a communication to push the opening in the middle whilst you go on your activities, but unfortunately didn't get here properly. But at the same, I'll read a speech for the Minister. She's called Honorable Sherry Aiti, a lady. So when you hear the female voice, it means she is talking. So I will read a speech. When I lift my head up, I'm talking my own. But when I read, you see my head down, that means I'm reading my minister's speech. Distinguished Chairman of AfriComNet, USAID Ghana, UN agencies, Health Communication Capacity Collaborative, AC3 Project, assembled guests, ladies and gentlemen. On behalf of the Ghana government, I welcome you to the beautiful city of Accra. We are delighted to host this gathering of esteemed experts from across the African continent and beyond. Thank you for inviting me here today to discuss the critical topic of monitoring and evaluation for health communication programs. The government of Ghana is pleased you've chosen Accra as the venue for this important meeting. We have much to share with you and much to learn from you as well. As public health practitioners, we recognize the importance of well-designed communication programs in alerting people to the importance of healthy behaviors, in motivating them to contemplate, try and adopt such behaviors, and to sustain healthy behaviors over the long term. In HIV, one of the many focus areas of AfriComNet, communication is essential to all elements of balanced prevention. Behavioral, for example, in promoting correct and consistent condom use. Structural, for example, in addressing gender norms, including women from accessing services. And biomedical, for example, in promoting adherence to antiretroviral medications. Increasingly, public health programs are requested to demonstrate the contribution of communication in generating uptake of HIV, malaria, and other health services, but also in achieving population-based outcomes such as reduced HIV and malaria incidents. Health communicators are being asked for more innovative yet rigorous methodologies to demonstrate the causal relation between communication behavior, service utilization, and health outcomes using inexpensive methods with quick turnaround times. Health communicators and social scientists are challenged to examine the emerging science of health communication, monitoring and evaluation, in order to expand knowledge, improve programs, and allocate the limited resources more effectively. I'm pleased that more than 100 implementers, researchers, donors, and other stakeholders from across the continent are here to delve into these issues and share lessons learned and best practices. During this 3-day practicum, you will explore pertinent issues such as meaningful indicators of program effectiveness, differences between monitoring and real-time reporting, options for rapid turnaround evaluation methodologies, and the requirements for rigorous causal attribution. The practicum will also cover other basic aspects of health communication, evaluating, including types of evaluation, reasons for investment in evaluation, options for evaluating programs with limited funding, monitoring techniques used in the private sector, and more. By the end of the 3 days, we expect that together you will contribute to the development of a resource kit for health communication, monitoring, and evaluation, and provide recommendations for improving monitoring and evaluation of health communication programs, particularly in Africa context. I look forward to receiving the materials and recommendations and seeing how they may be adapted to the context here in Ghana. I'll not conclude till I insert mine. And this one is from me, not the minister. I'm in the Ghana Health Service, and sometimes we want to measure the effectiveness of communication. Have you wondered what indicators should we write? For malaria case fatality, you can write somewhere the baby has died, under 5. Immunization, you inject somebody. What do you put down for? Communication, effective communication. You see, so begin to wonder. Is it when they hear the message? Is it when the attendant, they make the uptake or change their behavior? Or is it when it is sustained in the culture? That has been the key things. I remember a Bible verse where there was this man, Paul, a lot of faith, and then people questioned and he said that faith comes by hearing, and hearing the word of God. In other words, communication and then the content. So for me, I always see that when the communicators meet like this, how do you effectively change the culture of the people? Yesterday I was at the lorry station. It was Sunday, but I came in the afternoon. I went to the lorry park near my office. The place was so dirty. I had to call the people around. The porters. I went to the drivers. I said, why is this place so dirty? So the porters who have been making the place dirty, why are you not telling them, oh, they won't mind you? Okay, I went to the porters. But why are you making the place dirty? So we don't know that we are making a place dirty. Nobody has told us anything. Then they also blame it on the people who have been cleaning. So remember, there's something wrong. People have actually not sat down. The drivers, the porters, the people who are supposed to clean, the market women, to agree on what should be done. What is the basis for our meeting? What is the content do we communicate among ourselves? How do we transform it into a behavior change? So I believe the deliberations here will give me enough support to change what we are supposed to do. Because my job as a Director General is to ensure that I reach every place in Ghana with quality health service. And first, people should know about what they are supposed to do and what they are not supposed to do. They are supposed to change their behavior, and they're supposed to sustain that one in such a way that we don't have the many ailments that we have in Ghana here.